Asthma, the breathing condition that can quietly affect daily life. Asthma is a chronic respiratory condition that affects the airways inside the lungs. When someone with asthma comes into contact with certain triggers, the airways can become inflamed and narrow, making breathing more difficult. Asthma can affect people of all ages and may range from mild to severe depending on the individual and the surrounding environment. Common symptoms of asthma. Asthma symptoms can appear occasionally or become persistent over time. In many cases, symptoms worsen during physical activity, cold weather, or at night. Common symptoms include shortness of breath, wheezing, chest tightness, persistent coughing, difficulty breathing during exercise, fatigue caused by reduced airflow. In severe cases, asthma attacks may become medical emergencies if breathing becomes heavily restricted. Common asthma triggers. Many environmental and lifestyle factors can trigger or worsen asthma symptoms. Some of the most common include cigarette smoke, air pollution, dust, pet hair, mold, cold air, stress, respiratory infections. Indoor air quality is often overlooked, even though poor ventilation and accumulated allergens inside homes or workplaces can strongly affect breathing health. How lifestyle habits influence asthma. Certain daily habits may increase inflammation in the body and worsen asthma symptoms over time. Factors that may negatively affect asthma include smoking, lack of physical activity, chronic stress, poor sleep quality, excess weight. Obesity is especially linked to more severe breathing difficulties because additional body weight places greater pressure on the lungs and respiratory system. Helpful habits for better breathing. Managing asthma usually requires both proper medical treatment and healthy lifestyle choices. Helpful habits include avoiding smoking and secondhand smoke, keeping living spaces clean and well ventilated, exercising moderately to support lung function, staying hydrated, reducing stress levels, monitoring outdoor air quality, following prescribed treatment plans consistently. Understanding personal triggers is one of the most important parts of long-term asthma management. Final thoughts. Asthma is not simply occasional breathing discomfort. It is a chronic inflammatory condition that can affect sleep, energy levels, physical activity, and overall quality of life. With proper treatment, healthy habits, and good symptom management, many people with asthma are able to live active and healthy lives. Taking care of lung health today can significantly improve long-term well-being in the future. Anxiety disorder, when the mind never truly rests. Anxiety is much more than ordinary stress or occasional nervousness. It is a condition that can cause constant worry, fear, and emotional tension, even when there is no immediate danger. Many people live with anxiety every day without fully realizing how strongly it can affect both mental and physical health. Modern life often keeps the brain in a constant state of overstimulation, making it difficult for the nervous system to properly recover and rest. Common symptoms of anxiety. People experiencing anxiety may notice rapid heartbeat, constant worrying, difficulty sleeping, muscle tension, irritability, fatigue, panic attacks, trouble concentrating. Long-term anxiety may also negatively affect the immune system and increase the risk of cardiovascular problems. What can cause anxiety? Anxiety usually develops because of multiple factors combined together, including chronic stress, social pressure, lack of sleep, excessive caffeine consumption, financial difficulties, emotional trauma, constant screen exposure. The brain was not designed to stay under continuous stimulation without proper recovery. Helpful habits that may reduce anxiety. Healthy daily routines can significantly improve emotional balance over time. Some useful strategies include sleeping 7 to 9 hours consistently, reducing caffeine intake, exercising regularly, limiting social media usage, practicing meditation or breathing exercises, spending time outdoors, talking openly with trusted people. Even small lifestyle changes can help calm the nervous system gradually. Anxiety is not simply overthinking. It is a real condition that can affect both emotional and physical well-being. The brain needs recovery just like the body does. Learning how to slow down, rest properly, and manage stress can make a major difference in long-term mental health. Hypertension, the silent killer that millions ignore. High blood pressure, also known as hypertension, is one of the most widespread health conditions in the world. Millions of people live with it without realizing it, which is why it is often called the silent killer. Modern lifestyles strongly contribute to the development of hypertension through poor nutrition, stress, inactivity, and lack of quality sleep. What is hypertension? Hypertension occurs when the pressure of blood against artery walls remains consistently too high. Over time, this extra pressure damages blood vessels and forces the heart to work harder than normal. Blood pressure is measured using two numbers: systolic pressure, pressure during heartbeats; diastolic pressure, pressure between heartbeats. A normal reading is generally around 120 over 80 millimeters of mercury. Consistent readings above 140 over 90 millimeters of mercury may indicate hypertension. One of the biggest dangers is that many people experience no symptoms while internal damage slowly progresses. Why high blood pressure is dangerous. Long-term elevated blood pressure can damage nearly every major organ system. Possible complications include heart attacks, stroke, kidney damage, vision problems, heart failure, memory decline, blood vessel damage. Over time, arteries lose flexibility, increasing the risk of blockages and ruptures. Common causes of hypertension. High blood pressure rarely develops because of a single reason. Usually, it forms gradually through years of unhealthy habits and chronic stress. Excessive salt consumption. Modern diets often contain very large amounts of sodium, especially from processed and fast foods. Too much salt causes the body to retain water, increasing pressure inside blood vessels.
Foods commonly high in sodium include chips, fast food, frozen meals, processed meats, instant noodles, packaged sauces. Many people consume far more sodium than recommended without noticing it. Chronic stress. Long-term stress increases the release of hormones like cortisol and adrenaline. These hormones temporarily raise blood pressure, but when stress becomes constant, high blood pressure may eventually become permanent. Work pressure, constant notifications, financial concerns, and insufficient rest all contribute to this problem. The connection between obesity and blood pressure. Excess body weight places additional strain on the cardiovascular system. Fat tissue also affects hormone balance and inflammation, increasing vascular resistance and blood pressure. Even moderate weight loss can noticeably improve cardiovascular health. Warning signs people often ignore. Although hypertension is frequently symptomless, some people may experience frequent headaches, dizziness, chest discomfort, shortness of breath, fatigue, nosebleeds, irregular heartbeat. Waiting for symptoms can be dangerous because serious internal damage may already exist. Regular blood pressure monitoring becomes increasingly important with age. How sleep affects blood pressure. Sleep plays a major role in cardiovascular health. Poor sleep quality increases inflammation, hormonal imbalance, and stress on the nervous system. Conditions such as sleep apnea are strongly linked to hypertension and heart disease. People who regularly sleep fewer than 6 hours per night often have a higher risk of elevated blood pressure. Prevention strategies. Improve nutrition. Focus on foods rich in potassium, magnesium, and fiber. Recommended foods include leafy greens, bananas, avocados, oats, beans, fish, berries, nuts. Reduce intake of processed foods, excess salt, sugary drinks, alcohol, deep-fried meals. Nutrition directly influences blood vessel health and inflammation levels. Increase physical activity. Exercise strengthens the heart and improves circulation. Helpful activities include walking, swimming, cycling, yoga, strength training, hiking. Even 30 minutes of movement per day can produce measurable benefits. Reduce stress. Mental stress has powerful effects on physical health. Helpful stress management techniques include meditation, breathing exercises, spending time outdoors, reading, social interaction, therapy, reducing excessive screen time. The nervous system requires regular periods of recovery. Stop smoking. Smoking damages blood vessels almost immediately. Nicotine raises blood pressure, reduces oxygen delivery, and accelerates arterial damage. Quitting smoking is one of the most important steps for cardiovascular health. The importance of early detection. Many people assume they are healthy because they feel fine. However, hypertension can silently damage the body for years before causing a major event like a heart attack or stroke. Routine medical checkups and blood pressure monitoring are simple but highly valuable preventive tools. Final thoughts. Hypertension is not only a heart problem, it is a signal that the cardiovascular system is under continuous strain. Poor nutrition, inactivity, chronic stress, sleep deprivation,
and overstimulation all increase risk over time. Fortunately, small daily improvements can strongly protect long-term health. The earlier healthy habits begin, the better the chances of preventing serious complications in the future. Understanding type 2 diabetes. How lifestyle shapes health. Type 2 diabetes is one of the most common chronic diseases in the modern world. Many people develop it gradually over years, without noticing the warning signs early enough. The condition is strongly connected to lifestyle, nutrition, physical activity, stress levels, and sleep quality. What is type 2 diabetes? Type 2 diabetes develops when the body becomes resistant to insulin or does not produce enough insulin to maintain healthy blood sugar levels. Insulin is a hormone produced by the pancreas that helps glucose enter cells to be used as energy. When insulin no longer works effectively, sugar accumulates in the bloodstream. Over time, elevated blood sugar damages blood vessels, nerves, organs, and the immune system. Unlike type 1 diabetes, type 2 diabetes is closely linked to environmental and lifestyle factors. Early warning signs. Early symptoms are often mild and easy to ignore. Common signs include constant thirst, frequent urination, chronic fatigue, blurred vision, slow wound healing, increased hunger, tingling in the hands or feet, unexplained weight changes. Some people may experience no noticeable symptoms for years, making regular medical checkups especially important. The hidden impact of daily habits. Modern lifestyles contribute heavily to metabolic diseases. Long periods of sitting, processed foods, excessive sugar intake, and poor sleep gradually weaken the body's ability to regulate blood sugar. Processed food consumption. Highly processed foods often contain refined carbohydrates, unhealthy fats, preservatives, and large amounts of sugar. These foods can rapidly raise blood glucose levels and worsen insulin resistance over time. Common examples include sugary drinks, fast food, white bread, candy, packaged snacks, sweetened cereals. The body is not designed to constantly process excessive amounts of refined sugar every day. Physical inactivity. Regular movement helps muscles use glucose more efficiently and improves insulin sensitivity. People who spend most of the day sitting have a significantly higher risk of developing diabetes, obesity, and cardiovascular disease. Helpful activities include daily walking, stretching, cycling, swimming, light strength training. Even moderate activity can noticeably improve metabolic health. Sleep deprivation. Poor sleep affects hormone regulation and increases cortisol levels, which may raise blood sugar and increase cravings for unhealthy foods. Most adults require 7 to 9 hours of quality sleep each night. Chronic stress. Long-term stress keeps the body in a constant fight or flight state. This increases inflammation and negatively affects insulin sensitivity. Mental and physical health are deeply interconnected. Complications of untreated diabetes. If unmanaged, type 2 diabetes can lead to serious complications, including heart disease, kidney failure, vision loss, nerve damage, stroke, poor circulation, increased infection risk. In severe cases, advanced nerve and blood vessel damage may even lead to amputations. Early prevention and treatment are extremely important. Can type 2 diabetes be reversed? In many cases, especially during early stages, blood sugar levels can improve significantly through lifestyle changes. Consistent healthy habits may restore insulin sensitivity and reduce long-term complications. Healthy habits that support better blood sugar control. Improve nutrition focus on whole, nutrient-rich foods such as vegetables, lean proteins, fish, eggs, vegetables. Lean proteins, fish, eggs, nuts, legumes, whole grains, healthy fats. Reduce consumption of added sugars, soft drinks, processed snacks, excess alcohol, refined carbohydrates. Proper hydration also supports blood sugar regulation. Exercise regularly. Aim for at least 150 minutes of moderate physical activity per week. Consistency matters more than perfection. Even short walks after meals may help reduce blood sugar spikes. Prioritize sleep. Healthy sleep supports metabolism, hormone balance, immune function, and brain health. Helpful sleep habits include avoiding screens before bedtime, maintaining a regular sleep schedule, limiting caffeine later in the day, keeping the bedroom cool and dark, manage stress. Stress management can positively affect both mental and physical health. Helpful techniques include Meditation, deep breathing exercises, journaling, spending time outdoors, social connection, therapy or counseling. Final thoughts. Type 2 diabetes is not simply a sugar disease. It is a signal that the body is struggling with long-term metabolic imbalance. The encouraging part is that small daily improvements can create major long-term benefits. Better nutrition, regular movement, quality sleep, and stress reduction can significantly improve overall health and reduce future risks. Health is built gradually through everyday decisions and consistent habits over time.